Rapid Fire OB/GYN Review. Today, we are looking at core clinical competencies, focusing on the underlying physiological rules that make the correct answer intuitive. Take a look at this first question. It asks us to identify the specific stage of meiosis where the primary oocyte is arrested. To answer this, let's map out the biological timeline. Oogenesis begins during intrauterine life, where dividing cells hit a hard pause. The primary oocyte halts in diplotin of prophase 1 until puberty. Before ovulation, it becomes a secondary oocyte, immediately arresting in metaphase 2. Applying that timeline to our question, we see the primary oocyte is held in the diplotin stage. That makes option A the correct choice. Pinning down this exact timeline keeps you safe on exam day. The most frequent trap is confusing the primary and secondary stages, but knowing exactly where each cell pauses removes the guesswork. This next question focuses on clinical guidelines, asking for the ideal number of antenatal visits. We can calculate the total by following the standard clinical schedule. Visits occur once every 4 weeks until week 28, then every 2 weeks until week 36, and finally once a week until delivery. Summing those visits up gives you a total of 12 to 15. It is important to distinguish this clinical ideal from government minimums, such as the WHO's requirement of 8 visits or the Government of India's requirement of 4. Looking back, the closest match to our calculated ideal is A, 12 to 14 visits. This question targets nutritional requirements. We have a 49-kilogram patient in her first trimester, and we need to determine her additional caloric needs. There is a strong cultural assumption that pregnancy immediately requires a massive increase in food intake. The clinical data tells a different story. National guidelines dictate 0 additional calories in the first trimester. Requirements only increase later, an extra 300 kilocalories per day in the second trimester, and an extra 450 in the third. Since this patient is in her first trimester, her additional requirement is 0. Option C, continuing her current diet, is the correct answer. Standardized exams test your knowledge of physiological milestones. Sticking strictly to the data ensures you don't fall for distractors based on common misconceptions. Identify the incorrect statement about gestational dating. Options A, C, and D are true. Crown rump length is the best first trimester assessment. IVF uses the transfer date. Option B is the error. Gestational age is calculated from the first day of the menstrual period, not the last. Let's apply that definition. We must calculate the estimated date of delivery for a patient with an LMP of January 9, 2017. First, we clear the clutter. The obstetric score, G2P1L1, describes the patient's history but has no impact on our current math. Using Nagel's formula, we take the LMP, add 9 months, and add 7 days. Starting with the days, January 9th plus 7 days brings us to the 16th. Next, we add the months. Adding 9 months to January lands us in October. Combining those steps gives us an EDD of October 16th, which is option C. You now have 5 reliable rules for your next exam. Primary oocytes arrest in diplotin. The ideal schedule is 12 to 15 visits. The first trimester requires 0 extra calories. LMP starts on the first day, and Nagel's formula is a simple +9 and +7. If this